I am Dr.Andal bhaskar, practicing gynecologist from Nellore for the past 30 years. Um, what all I have learned is mainly from the mothers, and so I am always grateful to them. So the knowledge I gained, I pass on to the society. In that case, I am also grateful to the staff who are very supportive, without whose support I cannot execute what we are doing now. So the pregnancy and delivery, mm, feel it is a natural functions of the body. So we promote natural conception and happy, easy, normal delivery, and preparing the mother. So that is more important. And I would like to quote Dr. William Osler, who says, "A good physician treats the disease. A great physician treats the person with the disease." So that is what I have learned, that it is better we treat our mothers as a person, then it is easy for the body to overcome the disease along with the support of the treatment. So if we treat only the body with the medicine, when the mind of the mother is anxious in these days, which is more common, then it is very difficult for the mother to become successful. So for me, the successful this thing of pregnancy is the mother and baby must be not only healthy, they must be happy also. For that only we advise them to do lot of diet, exercises, and the thinking. We ask them to bond during pregnancy itself with the baby through the talk to baby technique. We ask the mother to talk to the baby during pregnancy. The baby responds through the movements. So when the bonding is there, and after delivery, it is very easy for the mother to continue the bonding. It is like during pregnancy, we are sowing a seed. In fact, we ask them to have a blueprint of the baby. Baby's health, happiness, intelligence, behavior, all these things, they can be blueprinted even before pregnancy and during pregnancy also. So these things are like sowing the seeds, and after delivery, it is just watering. So that is what we are going to see now. So the antenatal connection with the baby will be very important in continuing. It will be very easy. So it will be cakewalk to continue that. Otherwise, those mothers who can maintain the bonding, start the bonding even after delivery also. Only thing is they have to know, they have to be committed, and they have to be loving, patient, and with lot of concern for the baby. So we will now see what the postnatal care. I am very much concerned about this because I want everyone to know this, because of late my dream has been every child must be a very good child, and this can be molded. Earlier I thought the mother and father. Now what I feel, even others like grandparents, elders, friends, they can also motivate and start them. They can also have an influence on the baby. And postnatally, the role of the family is immense. Why we need to know this is because of the alarming proportions of increase in autism and ADHD is increasing. The child will be otherwise healthy, but it will be very adamant, very difficult to control. And also, once they grow up, half of them are intellectually, they may be all right, but what happens is some of them, because they are very unruly, they become antisocial elements. The other half, they may be very good. Recently, for the past 2-3 months, I have been hearing, and I'm very upset about it. The children are very well settled, very highly educated, very well behaved. They commit suicide even after settling in jobs, even after getting married. And this is very much disturbing because small failure, small setback, they are not able to share with others, they are not able to handle. They have seen only successes. We have grooming up the children for success, not for failure. Failure is part of a journey to the success. So that is what we need to tell our children. That is what we have to mold them for, and that is the period is antenatal and postnatal care. And postnatal, especially first three years, is very important, and that is what we will see now. For the baby to be very active, two things the mother must concentrate. One is the feeding, the next is the sleep. And once the feeding and sleep are adequate, then the baby is very active during daytime. It is able to bond well with others. So of this, sleep is very important, especially after birth. The baby sleeps for a long time. Slowly the waking time increases. Especially I would call the night sleep is very important, at least 4 to 6 hours undisturbed, both for the mother and baby. And this is some people, they think mothers, they disturb the baby and give feeding at least for every 2 hours, like that. They also suffer from lack of sleep, and also the baby. So once they feed around 11 o'clock, they can both of them can sleep undisturbed till 4 or 5 o'clock in the morning. This gives lot of good for the mother and the baby. And for a sleep, important thing is we tell them antenatally only, especially in the 9th month. From before only they'll be talking to the baby. The 9th month I'll tell them to tell two things importantly. One is the baby must have adequate milk, and it has to have breastfeeding only. And the second thing is the baby must sleep well in the night. It should not be disturbed. So one doctor who was a North Indian couple, both of them were working here, and she had come for a delivery. And 1 month later, when she came for a checkup, she said, it is not because both of them are living here. She said, it is not at all difficult to handle my baby, because my baby knows very well. It takes and night sleep, there is no disturbance. She said, it is a well-trained baby. That is how I find it. So that is what it is going to be, it should be. And another thing to this thing improve the quality of sleep and to get into the sleep is the lullaby. And important, we can use the womb song, what the baby heard during pregnancy. Mother can sing it or hear the song. More so, when the mother sings, it would be better. It can be just 2-3 lines repeated again and again. As the mother, the baby recognizes, even a day's baby, they can recognize the song and they easily go into sleep. But as the time passes on, once the mother starts singing, the baby smiles, the baby laughs, and it responds to the song. And there's a Dr. Zoo Palmer, he says, who's in charge of the Lullaby project in Royal College, London. He says, across the cultures throughout the world, the lullaby songs are similar. And the same tone, same way of singing of the mothers. And another child psychologist, British child psychologist, he says, it is very astonishing that the baby responds in coos and gestures to the song, and also exactly in time to the pulse and bar structure of the mother's song. So slowly they get into the groove, the mother and baby, the understanding. So both of them enjoy it very well. So the mother must look into the eyes of the baby while singing, and this is a very good way of bonding. And I would also suggest them to continue this song. When the baby grows up after 4-5 years, let the baby sing it to itself, so that whenever, this is the greatest gift we can give to the baby. As the person grows up, The song can be sung by him or her, so that whenever there is stress, this is a very good stress buster. So this is a very important thing, a gift we are going to passing on to the this thing, and this can start right from the postnatal period. So lack of sleep in the mothers, what I find when it for a few weeks or months they come with back pain because they get fatigued easily, so that the pain sensitivity becomes more, so they get a backache very easily. And also because there's a low immunity, they are more prone for infections, more commonly urinary infection. So when they present with these complaints, I immediately ask them about the night sleep, and when that is corrected, these problems can be corrected. So let us see how the babies communicate during daytime. We found that the feeding and sleeping must be very good. So then the baby will be alert. They communicate most effectively when they are alert and active. So, and this is very important for the brain growth, intelligence, and personality formation. And how we are going to interact with them? We talk to them, sing to them, then smile, laugh, and also play with them. And how they are going to respond? They are respond with funny faces, happy coos, like that. They are going to respond. And this is called, that is how we create a bonding or a secure attachment with the baby. That is, the mother is available and she responds warmly and consistently for the physical and emotional needs of the baby. For example, when the baby cries, the mother soothes her. And also when the baby is laughing and playful, mother also joins with it. And when the baby cries, the mother must know the reason for crying from the way the baby cries. So mother who is very observant, she will know whether the baby cries for food or for sleep or for love. That means the mother must take the baby. Till then the baby will not keep quiet, he'll keep crying. And also whether it is for comfort, for any nappy change, or whether it is for colic, pain abdomen. So it could be because of any allergy to the milk or any gas formation, indigestion, constipation, like that. So and initially the babies will start crying for these things, but as the baby grow up, they will learn to communicate in other ways, like movements, sounds, gestures, and facial expression. So, one of our mothers, she shared this experience. From the beginning, I was telling about African mothers' experience. Like African mothers, they used to carry the baby on the back with the sling, and so even before the baby gets to pass urine or motion, they bring down the baby and then allow it to. So the baby's clothes will not be soiled. If the baby's clothes are soiled, the mother is not said to be a good mother. That is how the African tradition goes. So when I said, she started telling her baby, it seems. So whenever the baby has the urge, it gives a peculiar sound and the mother attends to it. So this is how the when the antenatally the mother is connected, this can be done very easily. The communication will be very effective, and it's very easy to bring up the child. It is not very difficult. Other this thing, what is the important advantages to the baby? This gives a healthy awareness for the baby. The baby feels good about itself and it becomes confident as the baby grows up. Second thing is, it develops intimate and fulfilling relationships with others, because baby enjoys the company of others. It share as the baby grows, it shares its feelings and asks for help. And so as the when the person grows up, they can immediately rebound from a failure or a disappointment. This is very important, and all the foundation is laid during the first immediate postnatal period, first 3 years. And they express a eagerness or inquisitiveness, curiosity to learn. And the reason for this is the learning abilities and the memory tracks are laid down during pregnancy, especially from the 7th month onwards. So, after delivery, these are called nerve connections. So, the nerve connections are more. At birth, it is 2500 for a single nerve cells. From at the time of 2 to 3 years, it is about 15,000. As the child grows, the connections come down. This is mainly because these connections are called synapses, and once they become, the more they are used, and also when there is a adults, caring adults, they express loving relationship. These these connections, interconnections getting stronger. So this is called wiring. So initially it is firing and later it gets strong, that is wiring. So this forms the foundation for the personality of the children. That is why these children have enormous learning abilities, because these connections are can be reinforced, wired strong, so they can learn better, and that retains for a lifetime. And also when they are not used, and when there is stress, these connections are lost. Use it or lose it. This is how it works. So that is why this connection is very important. More so when the relationship is very loving, then the intelligence also improves. This has also been proved. Because spoken words, they stimulate thinking. So this thinking results in development of intelligence. And Professor Annie Fernald, she says, when the parents talk lovingly to about things that the children are interested in, then they develop language. They pick up language very fast. She says, even when the mother is very busy, 3 times where they can really interact with the baby, that is while bathing them, while clothing them, and while feeding them. These are the times they can get hold of this opportunity to look into their eyes, to make to play with them and interact with them, so that they develop language fast and the intelligence also is more. And studies have shown that children in the orphanages, where the interaction with others is less, sometimes the interaction will be very harsh, they talk very little, their IQ is very less compared with the normal children. So that is why our interaction and loving interaction is very important. And the benefits to the mother. So it relieves fatigue of from lack of sleep, and also there is less stress about learning new things to care for the baby. And also the mother becomes happy, confident, and energetic because of the bonding, because of the feeling that the baby understands, because that the baby responds, because the baby doesn't give any inconvenience. Because always a child who's crying incessantly, cry baby, is very difficult, very irritating, not only to the mother, to others in the house also. So I know a mother, because she was uh, taking treatment with us, and now she's her husband will always be on tour. So she was a very committed mother. She wanted a baby even before she conceived. She wanted a baby. She was a very good storyteller. She wanted to tell a lot of stories to the baby. She was a teacher earlier. So she said she's now also, the baby is nearly 2 years now, completing 2 years, and she is able to look after the baby single handedly, all alone, not with maids also, till recently. And she used to enjoy, and though sometimes she says it is a bit tiresome, but she says this is a sheer joy, going through the baby, seeing its developments, how, and she used to share her experiences. And this is a and very standing example for this benefits. And when the bonding is not so intense, when the insecure attachment is there, what are the disadvantage to the baby? There is a, he is less certain about the identity. So the child is less confident, and there is learning difficulties. And also the difficulty, they become introverts. Their relationship with interaction with others is very less. So when these go at a higher level, they go into autism spectrum disorders, ADHD, like that. So, how the mother must be prepared for it, and let us see now. So, we are all prepared for the joy and celebration of the birth of the baby, and we are not prepared for the stress and anxiety and the exhaustion and that it has. Especially the first 2 weeks are very stressful for the new mother. Why having a baby is stressful? Because it's an added responsibility that is 24 by 7. Also, there is a lack of knowledge and lack of preparedness also. The mother must be mentally prepared about it, so then it would be easy. In that case, I see always talking to the baby during pregnancy helps a lot, no doubt. But even after delivery also, they can develop the bonding once we know and once we are prepared about it. Also, because of lack of sleep deprivation, and there is no me time, so there's no personal time for the mother. So that also makes the mother easily anxious and restless. So once the performance, especially feeding, holding the baby, feeding and sleeping, putting the baby to sleep, these are all very difficult jobs once they are not mentally prepared, not physically and mentally prepared. So that way, what happens then, slowly there is a performance anxiety. So when it increases, the mother, it interferes with the eating and also sleeping of the mother. That is also affected. At that time, when somebody points out, you are not a good mother, you are not efficient, then she feels guilty. At that time, she stops even interacting. Her interaction with the baby becomes less, the interaction with others or less, she is withdrawn. So that is how, especially the 1 month period, the mother, even though mother and baby are physically healthy, mother needs we need to give more moral support to the mother. So what is the solution for this postpartum blues? The best thing is to bond with the baby, and the second thing is to take others help, to take husband's help, and also have a self personal time. So during stressful times, especially when the baby is crying, how to calm the baby? We need to know babies need outside help when they are restless. And also, we need to keep in mind that when the mother is anxious, she cannot appease the anxiety of the baby. She cannot calm the baby down. So, that she needs to understand. So, first the mother has to calm herself. She can have a deep breathing or take others' help, or just a change of place, moving out of the room, going out. That will be also be helpful. So once what happened, a mother along with the child went to the hospital. So at that time, her husband was busy. Every time husband used to come for a baby checkup. That time he was busy, so she went alone with the baby. And as soon as the nurse, she was waiting till the waiting time, baby was all right. As soon as the nurse asked the baby to be taken into the doctor's room, the baby started crying. So then they said, you wait outside and come after some time. Second time also, babies, the moment she was going into the doctor's room, baby started crying. And the nurse became restless. She said, you are not a good mother. You can't control your baby. This made her, feel all the more bad. She started crying. At the time, an elderly lady who was observing all those things, she just put her hand on the baby's shoulder, the mother's shoulder, and said, these are all quite common, ma. We have passed through these stages and come. Baby will settle because this is a new place. Don't worry. Go inside. Just talk to the baby for some time. Tell everything is all right. then baby will be fine. So this reassurance from a person at the right time, the mother became happy. Once the mother became happy and confident after just talking to the baby became calm. So this is this kind of support we need. It was there previously when there is joint family system, but now it is lacking. So we need to tell the household people, because they don't know that we need help sometimes. Unless we tell, they don't know how we feel, how tired we feel. If we tell them sometime to hold the baby for some time, unless we ask them, they don't offer this help. So we need to tell them what we want, and also how we need to be supported. That also we have to tell them. Only then they'll be able to give support. And also, it's always better to have a mentor. The mentor may be in the house or maybe far away, whom with whom we can confide everything and who can reassure us. So once in a way, we can completely pour out all our feelings. Talking to them will really energize them. We need to have a, especially mother has need to have a mentor like that. And also, if she's in a group with of friends with whom she can share her worries, insecurities, then she knows it is not for her only. Everyone has these problems. So then it's easy to face the problem and feel relaxed and better equipped to handle that. And also with the husband, team up with the partner. So sometimes in the frustration, we take out all the frustration, we take out on the husband. So we need to tell, we need to be aware of it, and we need to tell him how we feel, and ask him to help us in divide work about child care activities and home care activities, so that it will be a real help for us. We feel less stressed out mentally and physically. And another thing is, important thing is to have a couple time, or 10 to 20 minutes once in a while, so that it must be undisturbed and focused. This mother needs, because a husband's support is always like watering roots for the tree. That is what, once the mother's roots are watered by the husband's love and concern, then she can bring out best type of fruits. She can do any type of work, any amount of work, without any tiredness. She'll be energetic, not only that, happy. And the last thing is taking care of oneself. And we need to know meals is a priority. Sometimes mood is elevated after taking our favorite food, and the quantity and quality of milk also depends on the food. And activity, it is said that just walking outside, that gives us lot of happiness, because once we go out, we feel more relaxed. And Dr. Irving Krish, he has done a lot of work, and he says for mild depression, this outdoor exercises are more effective even than antidepressants. And Hippocrates, who's father of modern medicine, he says walking is the best form of one of the best form of treatments. He says, even if we go out, if you're still not relaxed, go out for one more walk. So he has lot of this thing about walking. He said so much about walking. So once the mother has done antenatally, if she has done walking after delivery, just walking 5 minutes, 10 minutes, 15 minutes, not a it will not be difficult for her. And also same way, sunlight exposure, so that gives vitamin D and also serotonin. It is a happy hormone. We get we become positive, happy with sunlight exposure, and get immunity also. And also similar stretching, yoga exercises, breathing, meditation. What we have done during pregnancy, we can do it. Even if we do for a little time, then do it. Once it becomes a habit, do it with interest, then our health become better. That is what I find with diet or yoga and exercise. When we do it very little, one or two exercises also they may be doing, when they do it regularly with interest, then the body's response is marvelous, sometimes amazing. Some people will be doing lot of diet exercise very rigorously, there'll not be any improvement. So that is mainly because of their based on their beliefs and doubts. That is why that's what I feel. And sleep, we need to have sufficient sleep. That's why I said nighttime sleep is continuous 4 to 5 hours sleep, and we have to manage it. And self care, we need to have some kind of activities where we mentally really relax, like reading a book or watching a movie which we like very much, or having a hot cup of beverages what we like, and massage, self care measures, all these things will really pep us up, so that we can go on doing, taking our child, however rigorous the routine may be. So, this is about postnatal care. So, we now saw about the food and the sleep, how to interact with the baby. Now, we'll see about breastfeeding. We all know about the breastfeeding and the importance. I'll not touch much upon it, I'll just go through. So, the colostrum is the earliest milk, and it contains a lot of protein, vitamin A and K. So, it gives immune resistance to the body. Long term advantage benefits of breast milk for the baby is the baby's IQ is more 8 points more than the non breastfed infants, because the DHA quantity is 30 times more in the breast milk than in the formula milk. Also, the incidences of respiratory illness, infections, and diarrhea is more in bottle fed children. And sometimes it is very uh, very miserable to know that some children are lost because of this infection, just because if breastfeeding was there, we would not have lost those children. So we always tell them during pregnancy itself we must be prepared for the breastfeeding. The important thing is only the intention of the mother, that is the best thing. And frequent feeding. And also other advantages, there is less incidence of obesity, diabetes, and allergic tendencies like eczema and asthma. Benefits to the mother is it helps because of the most of them while feeding they go into what we call as lactational amenorrhea. They don't get periods. So because of that, less of blood loss, the anemia, this thing is less. And also it is a form of speed, helps in spacing, that is contraception. For the next child, she'll not conceive that easily. And it works in at least 80%, gives protection against conceiving the next child. It depends on the frequency and intensity of the feeding. And it protects the mother from osteoporosis, breast and ovarian cancers. So the mature milk is called, there are two types. First half of the milk that comes is called fore milk. It contains lot of water, so it quenches the thirst of the baby. The second half is called the hind milk. It contains fats, so it satisfies the hunger of the baby. So we need to know that the baby takes sufficiently feeding, so that nearly 10 to 15, sometimes 20 minutes. So depends on the sometimes baby just puts to the mother's they start suckling, and immediately after a few minutes drops away. So this may only quenches the thirst, not the hunger. So the baby again starts crying. So we need to see that the baby takes the milk sufficiently. And some babies, even after taking feeding also, they'll be just hanging on to the mother. So that we must tell the baby, after feeding you have to they have to come out of the breast. So that also we must tell the baby. Another important thing is, before the feeding the baby, the mother must become must be alert. She must know over a period of time, she'll know when the baby will have the next feed, like every 3 hours, sometimes 4 hours, like that. So before the baby starts actually crying for feeding, it will give some kind of a intimation, like moving, becoming restless, like that. At that time itself, mother become ready for the, she must be in the feeding position, keeping everything ready, so that the what happens sometimes, the baby, once it starts crying, it gets immediately, if the baby doesn't get the feeding, they start crying so much and they get exhausted, so that finally when the mother comes and starts feeding the baby, it becomes exhausted, not able to take sufficient milk. And this is a very important point I want all the mothers and all the caregivers to know, so that the mother must be prepared. And one more thing is, mother must take something before feeding. If the mother is hungry, then she will not be in a position to feed the baby. So mother should not be empty stomach before feeding the baby. And also mother must be in a very relaxed, happy manner. Like while feeding, not talking to others, not watching movies, like that. She must be talking to the baby mentally and also physically. That is very important, because that is one of the timing the mother can bond with the baby. So at that time, baby will also take the feeding. She will have ample quantity, sufficient quantity of milk also. And how breast milk is produced? This is the nipple. Once the baby sucks the nipple, the nervous impulses are passed on, and prolactin hormone is produced. Prolactin helps in the formation of milk. Milk is formed here, and it is called lactiferous sinus, and from there it is stored here, and from there it is ejected out of the nipple. And the second thing is oxytocin reflex. Oxytocin is a hormone that helps in the let down reflex or ejection reflex. Once the milk is formed and collected in the lactiferous sinus, once the baby sucks, then the oxytocin starts functioning. The milk is ejected out of the nipple and enters the baby's mouth. So this oxytocin is very important. It is influenced by the state of the mental state of the mother. So once the mother is feeling good about it, she is very much interested in giving breastfeeding, and she lovingly cares about the baby, then she gets the feeding easily. And sometimes what happens after, initially sometimes the mothers may be getting milk, suddenly there may be less in the quantity, there'll be drop in the quantity of the breastfeeding. That's what sometimes when the mother has pain or has worry, anxiety, like that, then suddenly the milk quantity will come down. It is not because of the formation, it is because of the let down reflex is not there. Milk is there, it is not coming out. So one mother came like that, then we asked, she said she had taken an antibiotic, after that it has come down. Then we told her it is only a temporary effect. So once there is a drop in the quantity of the milk, the mother gets upset and she loses the confidence that that is all, I'm not going to get milk again. So it is not, once we start told them, reassured her, once she is confident again, then she resumed her milk supply as usual. And another thing is, first time when the mother has not breastfed, for various reasons, the baby might have been in the incubator for quite some time, or for sheer because of lack of initiative from the mother's side. Like that, if the mother didn't give breast feeding first time, the next time she can definitely have a she can have a normal breastfeeding. And this is mainly because the mother is upset, or she believes, and others also say, first time you didn't have breastfeeding, this time you are not going to have. So it is not like that. The experience of the mother during pregnancy also, for every child it is different, but for breastfeeding, for every child, the mother can have, even if the first time she didn't have normal amount, she didn't give breastfeeding at all, also she can have, provided she has there is no anemia. Anemia, we should see there's no anemia for the mother. And also the mother's intention is good. If the intention is strong, she must feel for the baby. So there we have seen, and also it is given in literature also, if the mother thinks about the baby, sometimes the milk comes out from the breast. So this is true. So once we really want it, the hormones, it acts in seconds and minutes. So, and similarly, negative thing also, if we have doubt, then we will not give any amount of convincing, any amount of logic will not work. So, the other things to help in breastfeeding or our diets, vegetables like green leafy vegetables are very important, apart from other vegetables like carrot, beetroot, bitter gourd, bottle gourd, and drumsticks, like that. And watermelon, fruits, almonds are also very good. In spices are very good, like fenugreek. The fenugreek is available as a medicine, also supplement in form of powder and also in capsule. Other things are fennel seeds, cumin seeds, and garlic. So this is about the diet. Other the important things in diet is bread, oats, rice, and fish, especially small fish. They say it is very effective. And regarding diet, we feel one diet is very useful for one mothers. It is not useful for everyone, but commonly it is used. But when we take it with good intention, we take it with strong intention, I must have, then it has. When the intention is weak, it is not strong, that any amount of these galactagogues, they are not very helpful. And another thing is, we need to have, mother must take lot of plenty of water, milk also. She can have 2 or 3 glasses of milk, depends on her convenience. And adequate sleep. If the mother has adequate sleep, then she will be relaxed. When she is relaxed, the prolactin and oxytocin reflex will be very good in action. And frequent feeding with the baby. And another important thing is positioning of the baby. The baby must be, neck must be straight, and also the whole body must be supported, and the baby's face must be turned towards the baby. The baby must be near the mother, and there must be eye contact with the baby and the mother. This is very important. That is why when the mother talks to somebody, watches something and feeds, then it will not be a very fulfilling, gratifying experience for both of them. So, and this must be, mother must take it as an opportunity to bond with the baby. And another important this thing we need to know about is the attachment. This black part is called the areola. Areola is the place where the lactiferous sinus, the milk is pulled, it is stored. Once the baby sucks the black part along with the nipple, then the milk flows very easily into the throat of the baby. Whereas when the baby sucks only the nipple, catches hold of only the nipple, the milk cannot enter into it. So the milk doesn't go, baby starts biting the nipple, and that is how sore nipple develops. So we need to educate the mother about the position of the baby, how to hold the baby, and the position of the attachment, that is how to, the baby should not catch hold of nipple, but also the black part along with it. And factors affecting breastfeeding. Studies have shown that when the lactation, that is breastfeeding, is initiated within first 1 hour of birth, then it is easy for the subsequent production of milk will be good. When the delayed initiation of lactation, the breastfeeding quantity will be less. Another thing is frequent feeding. So that is very important. When the baby is positioning attachment is not very effective, then also baby mother may be having this thing, but because of frequent suckling is not possible, then the lactation response will not be good. And bottle feeding also is very important. we have to avoid bottle feeding. If at all baby needs extra feeding, it can be given in a spoon or in a palada feeding. So that can be done. But the disadvantage of bottle feeding is sometimes because of this improper sterilization, babies are more prone for respiratory and diarrhea infections. And also because of the bottle feeding, the baby will not frequent suckling is not possible. So when there is no frequent suckling, prolactin reflex is not initiated, breastfeeding response will be less. And also baby develops what is called as nipple confusion. The bottle nipple will be larger, and so once and it very easily milk flows, the very less effort from the baby. So once the baby is very habituated for a bottle feeding, then it finds difficult to attach to the mother's nipple. So this is about breastfeeding. So we need to know that feeding, sleep, and loving interaction during daytime is very essential for the intelligence and also for the personality development of the baby. So Dr. Thomas Verney, who is a perinatal psychologist who has done a lot of work, he says when the baby grows up, if he is happy or sad, secure or anxious, aggressive or meek, these personalities is based on the messages he get about himself during pregnancy and also later. So we need to know about it, and we are knowingly or unknowingly we are sculpting the children's personalities. So we need to become conscious of it. We need to know about we need to have the knowledge, and we must be mentally prepared about it. We need to have good communication, and don't hesitate to take help from the family and also from the husband. And once we develop good rapport or bonding with the child, then the autism, ADHD, and antisocial elements, this suicidal tendency, all these type of these things we can bring down. And this starts now from the antenatal and the postnatal care. So talk to baby is a technique with which the mother can bond to the baby. So we have nearly 15-20 years of experience in this. And it is only the willingness of the mother. So the mother talks to the baby, and the baby moves and responds to the mother during pregnancy. And this is about talking to the baby. I have written about a book about the experiences of the mothers about talk to baby. It is called Garbhavidya in Tamil, and in English also released. And we have a YouTube channel called andalfertilitychannel, where our delivered mothers have shared their experiences. And it will be a very good, it clears a lot of doubt, and it gives a lot of confidence for the mother wherever they are. It is in Telugu. Very few videos have English subtitles, and those who are interested, they can watch them. And thank you so much for the listening.